What does the Tuskegee syphilis experiment, the HeLa cells for Henrietta Lacks, and coronavirus 2019 all have in common? Stay tuned. This is the Black Zeitgeist.
See, in this world, there's two kinds of people, my friend. Those with loaded guns, those who dig. You dig.
So, as you've already heard in the intro, we're going to be talking about the coronavirus 2019, otherwise known as COVID 19, in this episode. And we're going to be talking about two French doctors that basically set the internet ablaze with their blatant, overt racism over the airwaves in France that ended up being spread all over the world through the internet. And they definitely heard and felt that reverberation of that spread back to them very quickly. So let's go ahead and get started. So there were two medical doctors that were in an interview on the French TV channel LCI. The first medical doctor is Camille Locht. He's the head of research at the Interim Health Research Group. And Dr. Jean-Paul Mira, who's the head of intensive care at Cochin Hospital in Paris. Now, the two of them were having a conversation about the coronavirus, and both of them started to talk about medical trials and how to conduct them. And they suggested that Africans should be the center of those trials because they are, and this is what he said, and I quote, and I'll post the video right now, but I'll just put this quote, I'll post the video below, but I'll say the quote that he actually said, just so that I'm being accurate and you know that I'm not putting words into their mouths. They said, and I quote, this is Jean-Paul Mira at Cochin Hospital. He says, and I quote, "If I can be provocative, shouldn't we be doing this study in Africa where there are no masks, no treatments, no resuscitation? A bit like it is done elsewhere for some studies on AIDS in prostitutes. We tried things because we know that they are highly exposed and that they do not protect themselves." Right? So that's what he said and then after that, the Dr. Locht, who was at the Health Research Group, agreed. And he basically co-signed everything that the previous statement had said, and that they were looking into doing just that. Right. So after this conversation, the internet and Africans globally were in an absolute uproar. Rightfully so, because they were questioning, why in the world is Africa being targeted as the place that should be testing for the coronavirus when it has clearly not only the least amount of cases, but the least amount of deaths? So it makes no sense for, if there should be a place that has the most exposure to the coronavirus, and if that is the rationale as to why you would want to make a patient for a specific virus, the best and most logical place would be either Italy or France or Spain. Any of those three countries. Any logical person looking at the statistics and seeing where the most number of cases are would come to those conclusions for those three countries. Not one of them would come to the conclusion of Africa. It makes absolutely no sense. And now it's beginning to make it's starting to become crystal clear as to why you have some of these news outlets writing articles questioning why Africa does not have more cases. And I think they and just hear me out here, because it's starting to make sense that you would see articles like that, because you would need those types of articles you would need articles about how many cases there are in Africa specifically before you can then go and use that as an example and as a pre-measure, a preliminary step to then take the next step to say we need to test all coronavirus vaccines on Africans first. That is the reason why you had some of these news outlets say and wonder, why are there no cases Why aren't there more cases in Africa? And there's a lot of people on Twitter that had noticed that and pointed that out, asking why are these news outlets asking these questions as if they want African countries to have more cases. And that's exactly what they wanted. They wanted African countries not only to have more cases, but to just have more numbers so that they can then use that as an excuse to go into various African countries and test all of these different coronavirus vaccines on Africans, mess up their genetic profile and possibly even their ability to have children and their health for the future, to find a vaccine for themselves in Europe. And they know they can't do that logically if Africa doesn't have the most cases, because they would be called out on it as they are currently right now. So just be very, very careful about what you read on the internet when it comes to people from the West in regards to Africa and what's best for Africans. Do not be dumb and do not be naive in thinking that they have your best interest at heart. That has never been the case over history. That has never been the case in history. When they initially came, whether it was missionaries, it was more so economically driven. There are various Black and African scholars that had written that after missionaries had gotten there, it came to a point where the missionaries began to hold the deeds and the land ownership documents, and the indigenous Africans on the continent themselves began to actually hold the Bibles. There was an exchange there, where those who come from Europe began to own the land and began to own the natural resources, whereas those who were actually from the land started to own Bibles and started to focus on things that were not in their best interest initially. So those some things, and I'm not against religion, I'm not against any of that. It's just to be able to understand and think critically that when you have a people that wants what you have and wants and sees you as expendable, it's very important that you make sure that you question everything that they do. Now I kind of want to go on to the next step, and I'm not going to make this video any significantly long, but I just want you to understand the parallels between this situation and how they suggest the brutalization of African people, just to put it frankly, by experimenting on them and using them as lab rats. This has been a historical trend for probably over 300, 400 years now. You can go to African American slaves in the United States and see that the slaves themselves, the women, were tested upon for a variety of different birth techniques for doctors in terms of using different tools on African and Black women, on what they would then to use Black women's body to perfect how to give birth. And it was as barbaric as using knives and cut and all of these sharp objects on Black women's uteruses at the time, to be able to perfect what needs to be done for the white people who had come from Europe and the white settlers that had already been there at the time in the United States during the colonial era and after, right? So that is one. It's very important to understand that. But not only that, to then be able to take that one step, these are all things that you should look into and Google. Second thing I want you to Google and understand completely is the Tuskegee syphilis experiment, where they had tested, there had been a disease that they had given to a variety of different people in Tuskegee. There had been a cure for them to cure them of the syphilis that they had, but they were denied that cure for months to see how it had affected the human body. It hadn't been months, it had been years. A lot of people died from that, right? They were specifically denied that because they were used as testing lab rats, and they had died from these diseases. Please look into the Tuskegee syphilis experiment. Then after you do that, look into Henrietta Lacks. She was a Black woman in the United States that doctors had taken her cells unwillingly. She didn't sign off on any of this. Doctors had taken her cells and used her cells as an African woman in their research for genomic data and cells that are basically it's not indestructible, but it's cells that can be regenerated and reused for a variety of different research. And if you look into HeLa cells and what they've been able to cure, there are so many diseases that have been able to be cured based off of Henrietta Lacks's cells. And that's something you should also look into as well. There's an entire documentary on her, portrayed by Oprah and a variety of different actors. And I think this is something that you should always learn. And the reason why I'm bringing all of these three things in together is so that you can understand that this isn't a new thing. They have always done this. They continue to do this, and it is until we stand up for ourselves as we're doing now, before we can get to a place where none of this will be tolerated any longer. People are being put at risk. Our elderly are being put at risk. Our young children are being put at risk and are dying for no reason because we are not holding these people to task and preventing them from destroying not only our people but our genetic profile. Who knows what can happen in 10, 20, 30 years by taking some of these vaccines that we don't know entirely how it affects our DNA, because we don't have our own regulatory bodies doing the research to determine if it is safe for African people specifically. Because though it could be safe for Europeans, there are ways to engineer different biotechnology drugs, biochemical drugs that will then affect Africans specifically and might not affect a European genetic profile. So I'm just saying all of these things that we really do need to get our act together, and I applaud all of the different Africans that have been holding these two doctors to task, and those who are actually in positions of power as well, like Dr. Machida Diso Moeti. She's the WHO, the World Health Organization Regional Director for Africa, who stated, and I quote, she was very surprised, deeply upsetted. And she said, and I continue to quote, all research, including on COVID-19 and this global crisis, must be ethical and based on principles. End quote. There's another Dr. John Nkengasong, head of Africa CDC, right? He said, the Africa CDC and WHO will work closely to ensure that clinical trials on COVID-19 in Africa are carried out using the most ethical and scientific principles. End quote. Which is fantastic. All of these different people, I'm hoping this has already been happening. And I hope people understand that this has already been happening. And I'm glad these two racists were bold enough to say this on national media, because hopefully now there can be a spotlight on clinical trials and how it affects Africans, because there's so many Africans that are probably dying from clinical trials that we don't know of and are done in secrecy that need to be brought to light, and that these different chiefs and heads of the WHO and the CDC for within Africa need to start holding themselves accountable, and we the people need to start holding them accountable, because we cannot continue to allow these Europeans to get away with testing things on us as if we're the world's lab rats. Not any longer. So this has been the Black Zeitgeist. I hope you have enjoyed this. Please do. I'll leave some links in the description below if you wanted to find more about some of the experimentation that were done on Black women during the period of slavery in the United States, and some of the Tuskegee syphilis experiment that were done on a variety of different people, Black men and women, and the Henrietta Lacks research that had been done after they had taken her cells unwillingly and made billions from it due to all of the different medicines that have been developed from the research on her cells specifically. And her family has not seen any dime from any of that, right? That is another thing that we also need to talk about. So please research all of those different things and ensure that you are well educated, because if you are not knowledgeable about the history of how doctors have been fueled by racism as well, we will continue to suffer the consequences. So this has been the Black Zeitgeist. Please do subscribe. Please do hit that like button. If you had liked this, I will be posting more videos on content relating to Africa and the United States and the Caribbean and the global Black family overall. Until then, I will see you next time. Stay safe, wash your hands, and be well.